All right, so we are live right now, and the conversation this evening won't be about money. Today it's going to be about our lives and our health. And so I want to check the network and then to see that we are actually live, so that I can take the post. Okay.
Okay.
All right, so the link, the we are live and it's working absolutely fine. So I'm going to send you the link to the live stream, and then I can also send to my Telegram channel.
Okay, sir.
Yeah, so but we are live right now, and welcome everybody who is tuning in to watch us. Let me send the link to my.
Welcome, everyone. Welcome.
Right, guys, if you are coming on board, you're welcome. You're welcome to this live stream. Welcome, welcome, everybody. Okay,
Welcome.
so I've sent a link to my Telegram channel, and hopefully, people are going to join us today on this live stream. All right, without wasting so much time, Miracle, I want to share with you an experience, and it's one of the experiences I don't really like. I think I shared it on my post before the live stream. When you are drinking water, right? You're drinking water,
Okay.
and thing goes. I don't know, where does it really go. You guys are into medical, and you take the water, and then I don't know where it runs into, and then you are choking, sort of find yourself coughing and coughing and coughing because I mean the air, you are now not receiving good air or something, to get into your lungs, and you're coughing and coughing and coughing. It happened to me like a week ago, and it wasn't a very nice experience, and nobody was around me at the time. I had just taken water from
Wow.
the fridge, came out to the parlor to sit down in the sitting room, and then water just went into another, and then I began to, it was looking like as if I had waterproof all over my head, like somebody wearing waterproof over your head, and the person is choking you. That was how it felt like. This kind of things can happen at home, and somebody, not just that, there could be accidents, there could be other things that can happen in the house, fall, hit you. Like one of the things that I usually I'm very, very scared is, for example, somebody visiting in the house and or even in the hotel and wants to take a shower
Yeah.
and sleeps on the tile. So I'm usually saying, please pay attention to the tile. Like in my house, we have tiles in the bathroom, but the tiles they have rough faces. They're not smooth, But you go to certain houses, they're using tiles, but those tiles are smooth surfaces that when water pours on top of the of the tile, someone can sleep. For example, before coming on this live stream, I was in a bank and they were mopping the floors, and the tiles were very smooth, and I had to just walk gently on the tiles, so that I wouldn't sleep. So just for us to start out in this conversation, what can you say about some of the incidents, I mean, if the things you've heard about or things you've witnessed, where someone is at home and the person has these kinds of incidents? What can one do in the absence of a doctor at home?
Okay, you mean when the person is alone?
Yes, like at home, alone, or in the family with your family, and some of these incidents happen. If you can point certain circumstances as we begin to move into the main conversation for the day, what can they do? I mean, in the absence of doctors, what can someone do in order not to lose his life? You can pinpoint certain circumstances you may have witnessed, while authoring your book, and then give us what we can do in such situations.
Okay. Let me take for instance. let me take for instance the what you said when you were drinking water and you almost choked. The thing is, um, when someone has an emergency and the person is the only one around, at the first thing to do at that point is to remain calm. That's the first thing. Even we as nurses and doctors, when
Miracle.
we
It wasn't easy.
yeah,
It wasn't easy for me to remain calm. Imagine that you are coughing
yes,
and you were
you
like
know,
gasping for air. Like, how would you be able to remain calm in that situation? Tell me.
yes, okay, in the book, I stated the rules of first aid. Even though it is quite difficult, but the first rule in first aid is for you to remain calm. Because if you are not calm, you are going to make a lot of mistakes that might probably deteriorate the situation at the point. So no matter how frustrating it is, no matter how much you're on pressure, it is advised that you still stay calm. Even us, when we are working in the emergency section, or we get see an emergency, and maybe a lot of things happening at the same time, we actually remember that the first thing we need to do at this point is to be calm, because it is when you are calm that you start to remember everything that you are supposed to do. Now, that is why it is advised that people should have a section of their phone where they store emergency numbers, so that if something like this happened to them, they can quickly, or somebody nearby can actually know what to do, or like contact somebody immediately through those emergency lines they save. Now, if you are a person and you are alone and these things happen to you, and you entered into maybe you started choking, we just hope it is not a severe choke, because even in severe choke, the best thing at that point is still to remain calm. That's the first line of action. Then if you can summon so much strength, you dial a number in your phone. If your phone is close to you, dial a number in your phone. But if it is nothing sort of that in that situation, you can try to, crawl out to where people can see you, just to make people see you and know that you are having an emergency situation. And but if somebody is close to you, it is quite easy for the person to identify that maybe this person is having an emergency situation, and probably the next line of action is for the person to take you to the hospital. But in most cases, when the person might take you to the hospital, things must have already gone back. But the first line of action is just to remain calm and follow these things I just outlined. If you have your phone close to you and you have energy, you just dial a number, or you send a message, or you can crawl out to where people can see you, just with the last strength and energy in you. Crawl out to the next where people can actually see you, because at this point you're alone and you cannot really do much for yourself. You can't do much for yourself. It is quite different from maybe when you are bleeding somewhere. It's you can actually get something, apply pressure on those areas. Those ones are actually things you can do yourself. But when you are choking in something, you actually need, if it is not something that is if it is something that is too bold, or maybe like a bone, you can try to cough it out. Is another thing is to know the extent at which it has gone, because you might try to cough it out and then it will now enter into the larynx. The larynx is more like the air bus, where the oxygen now flows, and it's going to cause further deterioration. So if you can try to cough out something at this point, it's okay. But if you can't, just summon courage, crawl out to where people can see you, and then still remain calm. That's why it is an emergency. We cannot really do much, especially if the person is alone. I don't know if I made a very clear point.
Okay. All right, guys. If you are just joining us now, I'd like you to do two things basically. Introduce yourself in the comment section. Let's know your name, where you're tuning in from, and what you do. All right, your name, where you're tuning in from, and what you do. That's the first thing to do. Secondly, invite your friends, tag 20 of them, 30, 50 of them, let them be part of this conversation. It's all about health. It's not about money now. It's about health. It's someone who is alive. It's someone who can make money. All right. And today we're looking at how to become a home doctor, and how. Another thing that I wanted to share with you my thoughts. For example, why it's important, because I have a copy of your book here, The Home Doctor, and we're going to be talking about the book in a few minutes to come. All right, this is my own copy, guys, written by my guest, Miracle Chinedu, The Home Doctor. All right, that's her book with me. I usually think about people who can run into certain health issues at night, and for families who don't have cars. So imagine that there's a lot of things I think about. For example, in traffic, you are so stuck in traffic and somebody has a health issue, maybe a heart attack or a stroke or something like that, and you're the one driving this individual, that kind of thing. There's traffic, there are cars everywhere. You can't even maneuver through the whole jam. And also in the night, I think about these things sometimes in the night, in the place where I live, where maybe a family doesn't have a car and the individual has this health issue at night, how to be able to get the individual to the hospital or even, and that is where I see your book comes into play. What can you think of? What can you say about that? Vis-a-vis when people tell us, oh, we cannot be a doctor. Many of us are doctors by ourselves. What do we mean by that?
Yeah.
So somebody's having headache or having fever, the next thing, oh, it's malaria. And then you go and you buy drugs from the pharmacy, mix it up, give me antibiotics, give me malaria tablet, give me what's it called, vitamin C, give me, and then you administer the thing, and then of course many of us get well. And yeah, I don't know if we call it the mercies and the graces of God. Many of us do these things in Nigeria and we get well, and all over Africa. All right. But what have you to say? Where should we have a balance? Having listened to these things I said, where people may not have instant access to medical facilities where they can be attended to in case they have these health issues. So, what is the essence basically? These foundational things we need to know about taking care of our health at home, all right? Becoming like a home doctor, so to say, which is the title of your book.
Okay. I will start with saying that if it is in a very proper setting, like in the Western world where everything is perfect, almost perfect, the health system is very top notch. We have lots of first aid um, materials that's what called AED and some other things hanging at different corners in the streets. And then in this situation, that is why we encourage people to actually learn the basic first aid skills. It doesn't really cost much. You must not be a doctor, you must not be a nurse, you must not even have a well detailed knowledge of medical issues. Just need to equip yourself with simple first aid measures, like know how to handle bleeding, know how to handle choking when somebody is choking, or when someone is kind of having slight bleeding, know what to do. And if it is also possible, I think there are some states that actually have a working emergency number. I think they are trying to rectify the one in my state, Abia State. And if you are in your state and you have a working emergency line, you dial the number ASAP while you still while you actually carry out the basic first aid skills which you've learned. That is why knowledge is very, very important. Some people feel like since they are not doctors, it doesn't concern them. That is because they've not, maybe a relative of theirs have not actually had a medical emergency that can cost them their lives. So it is very, very advisable that people have the knowledge of um this first aid skill. I don't know, can you hear me? Okay, that is why it is actually advisable that people have a very good background knowledge of this first aid skill, and also have first aid materials, have first aid boxes at home. You might not have the complete thing, but just make sure you have the simple things. And then, I always advise people, when you have a health challenge or you think something is getting out of hand, the first line of action you should do, when it is not actually an emergency, you've not perceived it to be an emergency, is to go to the doctor, to the hospital, you go to you visit the doctor. Because most people take laws into their hand, they visit the herbal doctors and all of that, which is actually very wrong to me. I don't advise anyone to do that as a health practitioner. So it is very, very important that we all have a basic background knowledge of first aid skills and have first aid skills at home. And then if you are in a state where your medical emergency number is working, you should actually have them in your phone, have them stored in your phone, so that even when you are in traffic and something happens, you dial the emergency line, and you can get a quick response, even as you are making plans to transport yourself to the next available clinic or hospital. I think.
Okay, thank you so much for that. So now brings us to the conversation for today. This book, all right? This is a copy of my own book, The Home Doctor: Master How to Save a Life When There Is No Hospital or Doctor Around. What inspired you to write this book? Go ahead and tell us before I go into the chapter and all that. What inspired you? Did you have any experience whatsoever? Did somebody die in your care? What was someone rushed into the hospital? Meanwhile, tell us a little bit about yourself, your background as a nurse. Because I don't think you had that conversation. You didn't have that introduction of yourself. Tell us your background as a nurse.
Okay, my name is Miracle Ihunayati Chinedu. I'm a registered nurse. I'm based in Umuahia and Abia State. So I've been practicing for 4 years now. And I run a home care agency in Nigeria where we provide exceptional services and exceptional home care services anywhere across Nigeria. We have our nurses in Abuja, even as far as Sokoto, Owerri, Abia State. We have some doctors and physiotherapists that are also registered with our agency. So I also work with the Institute for Humanitarian Studies. I'm a humanitarian, a professional humanitarian, a certified stroke nurse, and a basic life support and advanced cardiovascular life support provider. So my inspiration to writing this book, actually, I lost my grandma when I was 13 years old. Yeah, when I was 13 years old. And it was something I felt could have turned a better way. There would have been a different result if things were properly handled. She had an accident. She was hit by a vehicle, and which led to head injury. And with the reports, I actually got a lot of things were mismanaged right from when she was knocked down on the main road to when she got to the hospital. It was quite a long time, and a lot of things went wrong. And then, as a registered nurse, I've not always wanted to, be like the regular nurse, staying just at the bedside of the patients and all of that. Don't get me wrong, I love bedside nursing. In fact, it's the most interesting part of nursing, because you get to practice clinically based things you've been taught. So it came as a burden in my heart, because I see a lot of people dying that shouldn't die. I've witnessed people slump. This was before I even entered into the nursing school. I've heard stories of people slump, and when they slump, you see people taking pictures, making videos to post on social media, when they can actually do something. this person is going and you are taking pictures of it, you are making fun of it to post on social media. It's wickedness. It's This was why when I launched this book, I organized a free basic life support training. Yes, it was free. Come and learn everything that has to do with basic life support. You come and learn cardiopulmonary resuscitation free of charge. We brought them from Port Harcourt. We paid everything. um we in fact we actually went through this book and we taught people for free everything that they should do in times of emergencies. So to me, I believe that as a nurse, you have the knowledge that people need. So why not put it out there to help people? This book actually came from the side of me that I naturally want to help people, and I believe that a lot of people would live if they get to know a lot of things about their health, how to manage medical emergencies. A lot of people have gone, a lot of people are dead because they didn't have this knowledge, and people around them didn't have it too. So this is what concerns everybody, because we don't know what might happen to the next person beside you tomorrow. A colleague of mine lost his husband. He slumped. Nobody knew what happened. He slumped. Imagine a registered nurse losing your husband to this kind of thing. And you have the knowledge, but people around your husband didn't have the knowledge to actually resuscitate him. At least you if they have a good knowledge of cardiopulmonary resuscitation, at least it would have elongated his time, made him stay for a longer time until his wife comes on, or until he gets the proper medical attention and he's better. So these are the things I consider, these are the things that really motivated me to write this book. And one striking thing about it, I started writing this book since 2021. Yes, I started writing this book 2021, 2022, 2023. I launched it. So approximately 2 years. I took my time, and as the year goes by, I updated everything in it. So everything in this book is updated. It went through rigorous processes. It went through consultants. It went through them registered nurses who are very much far much more behind. I mean, above me. And the person who wrote the forward of this book is also a doctor. So everything in this book is actually valid, because I believe that if people can have the knowledge to handle most of these things, the mortality rate in Nigeria, most especially, will decrease. Yes, it is my way of contributing to Nigeria, as the health system in Nigeria is gradually deteriorating. So this is it, sir.
Fantastic. Um, so I remember one thing that happened in church one time. One guy, it was a young guy. By that time, we were still, I think the church was still where I worship now. They was still building at the time. And so I think it was during, when they were praising and singing, and the guy went flat on the floor, and then started rolling around. People are usually, in church like that, when it happens, people will be like, okay, maybe he was struck by the Holy Spirit or something. But I was just I was just by the side. I was looking at the guy, as it was, initial time that he was. I just noticed that this wasn't just anything Holy Spirit or whatever. This guy had a medical issue. So I quickly had to, beckon on the ushers and some individuals who were around, and then went quickly to the guy. I think one of the ushers or so, it's a medical person, and he quickly said, "Yeah, I think he's having an epileptic seizure." So all they did was that they just surrounded the guy and they just let him. And I was there watching, and the guy finished having the seizure and stood up. But the shame and all that, and people around him, I think they had to take him
Yes, yeah.
from there and took him away, whether they took him home or something, you know. I don't know if you face something like that, where people will begin to ascribe certain things that happen around us to maybe spiritual attack or something. I want to know your take, even a nurse. I know certain things must have happened in the hospital, where people come and present with certain symptoms. For example, there's a friend of mine, or let me say two people that I've come across, and their mothers are based. One is based in Calabar, another one is based in Akwa Ibom. And so she came to me and said there's something that is happening to her mom that they call it crossing belt. I'm like, what's crossing belt? She was like, okay, it happens such a way that the woman will start having rashes on her belly side. And when those rashes are spreading, and they form like a circle around her and meet somewhere at the back or at the front, the person will die. I'm like, I don't know what that means. And I'm like, okay, how old is your mom? She said her mom is about 60 something. And I said, what does your mom do? Does she have money? She was like, her mom doesn't really have money. I'm like, okay. The second person, the same thing. And I began to think in my head, how come these people in the village are attacking your mom, their moms with this crossing belt thing? I've not really understood what that thing means. Sometimes you find out that somebody made a post and said that what we tend to ascribe to being spiritual sometimes or religious or spiritual attack could be something that has not been diagnosed. For example, there's no CT scan in your area. There's no, for example, my father needed to have a scan, and there's no, what's the name of that machine again? Why am I? It's coming to my head. Something MRI exactly. They didn't have. They
Okay,
don't
Emma.
have. They don't have MRI in a worry, and we had to go all the way
Yes,
to
they
Port
don't.
Harcourt.
They don't.
Even in Port Harcourt, it's just at the hospital in the government house that has MRI machine. That's to tell you. And when I inquired, they said the MRI machine can cost up to 3 billion naira to acquire. I'm like, what the heck? That means it means
It's
only
very
billionaires
expensive.
billionaires can hold. And then they even said something with the MRI that they're in levels. They're in levels. They are the ones that are lower level and the one. If you want the one that is high, whatever, that can give you very, very, very precise information. That one
Yeah.
is up to 4 billion. I'm like, geez, so only billionaires can actually get that. So imagine that you have a disease that an MRI machine has to show you what exactly it is, and you don't have access to the MRI machine, and you now say spiritual attack. I know you've had those experiences. Vis-a-vis you writing a book to help people, with their health and all that. What role has this to play, especially in Nigeria where we are?
Sorry, your
Where
network is breaking. It.
can you hear me? Can you hear me now?
Yeah, I can hear you now. I can hear you.
Yeah.
Yes, I can hear
Okay.
you
So I
now.
said, what do you think this thing about religion and spiritual attack? What do you think the role they play with regards to our health, especially in our nation?
Okay, first of all, as a medical practitioner, as someone who is in the health system, um, most of the time we are not actually advised to bring up these spiritual matters to people, in as much as my duty as a nurse is to, oh my god, power bank, god, the power bank. Hello, can you hear me? Sorry, my lights went off.
Yes, I can hear you. I can hear you.
Okay, so can you hear me now?
Yes, very.
Sorry, my lights went off. Okay,
No problem.
so okay, so in as much as we are not actually advised to bring up things like um spiritual matters, and all of that, so we try not to actually bring that up, but we do not actually we don't, as human beings, we don't actually deny the fact that these things exist, that these things is in my bag. Sorry, we don't actually deny the fact that these things exist. But nevertheless, before you jump into conclusions that this might be a spiritual attack, we advise people, do the necessary things first. Do the necessary things you are supposed to do first before you start jumping into conclusions. Because we've had situations where people believe in their mind that this is a spiritual attack, and they went spiritual when this thing is actually something they can handle medically. And the longer they spend thinking it's spiritual matter, the longer time they spend, the more worse the situation is. And by the time they realize what they must have done and come to the hospital, it's late already. It's late already. There was this case when I was working in one of the hospitals in Umuahia. This woman was having delivery. She was delivering her child, and she started bleeding. And her husband took her to church so that they can start conducting the delivery there and be praying for her at the same time. I don't actually understand how that works. So by the time they brought the woman to the hospital, the woman already started gasping for air, and she died. The woman died with that bleeding. So before people start jumping into conclusions that this is spiritual problem, that it is a spiritual issue, it is not. We advise them that they should actually do the proper thing. Go to the hospital, get a proper test, go to the hospital. Because most of the time these people feel like doctors are going to charge them a whole lot, that they are going to charge them, and that they don't have money for all of this, when they are actually doing themselves. I've had people saying they don't have money, and they spend money. There was this girl where I went to make my hair. She said she pays 2,500 every week to buy herbal medicine. 2,500 every week, and she has done it for 1 month. So calculate that amount of money. It is enough for you to even buy card in a hospital and see a proper doctor. But no, most of them wouldn't want to do it. They want to try to save cost and believe in their head that this is a spiritual issue, that it is their uncle, that they will have to go spiritual. And most times we advise these people, even if you believe it is a spiritual issue, still consult the doctors, so that if you are handling it spiritually, you're also handling it medically. So whichever one you want to do, it must surely work, except if your time on earth is actually up. So this is an advice to people. If you believe something is spiritual, you are having a spiritual issue, you should also be doing the medical route. See a doctor. You should also see a doctor while you're also making prayers, while you're also going to prayer houses, so that you don't lose both ways, because that is the case most people have. They lose both ways when they actually leave this side and focus on the spiritual side. I think I made a clear point there.
Thank you so much for the clear facts. I'm grateful. So, I'd like you to take us on a journey, chapter by chapter, about the book. There are 7 chapters in the book right now. I'm holding in my hand. The first chapter talks about first aid. Chapter 2 talks about life-threatening conditions. Chapter 3 about hemorrhage, and take us journey on a journey. Can you hear me?
Yeah, I can hear you. Sorry.
Seems your light is having some issues.
Sorry, I
Okay.
can hear you.
Yeah. So take us on a journey through the chapters in the book. In chapter 1, it's about briefly on each of the chapters and why this book is necessary for us to get copies of it.
Okay, so all right. So in chapter 1, of this book, I actually that's the part where I actually elaborated on the concept of first aid. where I define first aid. And one thing I said about this is that first aid is actually the first immediate and temporal treatment given to a casualty. It is the first thing to do in the midst of casualty. It is the first thing to do, and it must be immediate. We don't say wait. You must do it, because if you don't do it, you can lose this life even at 10 seconds. At 10 seconds is enough for damages to be done. And another thing is, it is temporal treatment. Yes, it is temporal, because you are doing this just to actually keep the person stable at that point, while you actually work on making the person receive an adequate treatment in the hospital. So, for example, if someone is convulsing, the person has epilepsy, you don't, okay, when the epilepsy stops, you don't say it has stopped, thereby I'm not going to say the doctor. For each time it happens and maybe you do something and it stops, it is actually a temporal treatment. You should also get a proper treatment once it is done. So another thing I discussed in this book, the chapter 2 of it, is prioritization of life-threatening conditions in first aid. You know, what actually led to me writing this chapter is to actually make people know that when it comes to an emergency situation, there are things you need to consider first, and this thing is called triaging. Triaging is actually looking at the most critical cases and handling them first. This is what triaging is. There are a lot of things that surrounds our triaging of patients, which is actually our duty as health professionals. Not this one is actually is not fully for the public to know, but it is also good they have the background knowledge of this. For example, you see someone, there is an acronym for this. We have ABC, where the A is the airway, the B is the breathing, and C is circulation. So for example, someone is actually bleeding somewhere. For example, someone is bleeding somewhere, and then the other person is choking. The person cannot breathe. The person cannot actually breathe. Like, there's no passage of airway. There is no air going in and out of this person. The first thing in this situation to do is to handle that person with the airway issue. If the person is choking and that is the cause of the reason why the airway is blocked, try to remove the cause. Try to handle that first. Then after that, you now come to someone who has bleeding. So these things are in place so that when we actually have when we have lots of people to handle at the same time, we actually go for the most critical ones, the ones that, and also when it comes to these things, we actually check out for readily available materials. So this is one part most patient relatives do not understand. They can come to a hospital and the hospital is jam-packed, and it's an emergency. The thing is, emergencies happen every day, and if we are God, if we had the power to do these things, we wouldn't want our relatives to actually have medical emergencies. But how be it, if we find ourselves in this condition, it is actually very hard to actually understand what is going on at that point. Everybody's tense, and everybody wants to do a lot of things to save their own person. So that is why most patient relatives do not understand that when it comes to emergency and you bring a patient to the hospital, there are actually priorities. There are things you should consider first. And that is most of the things what I discussed in this book, that will actually make you, even when you are at home and you are not a medical practitioner, you will know how to handle most of these things on your own. And in this chapter, I discuss on how to handle respiratory arrest. Respiratory arrest is a situation where someone stops breathing abruptly. No signs of breathing. The person just stops breathing abruptly. It is a very serious emergency. So I also discussed, in chapter 3, I have what is called, I discussed extensively on the circulatory system, where I discussed about cardiopulmonary resuscitation, shock, and bleeding. So these things, in this book, I discussed it system by system. So every system of the body was discussed here, and it was simplified. I didn't use medical jargon to describe anything here. So it is well explanatory. So here I actually discussed the step-to-step procedure of carrying out cardiopulmonary resuscitation. And yes, I explained everything there. How to perform cardiopulmonary resuscitation for infants, newborns, for adults, for children. There are steps to do that. You don't just, one thing about this thing is you need to know how to do it, this cardiopulmonary resuscitation. That is why we do it yearly. We train people yearly free of charge on how to do this, on how to carry out cardiopulmonary resuscitation, because if you are not skilled in this, you might injure the person while you are trying to save the person. You might injure the person. You might give the person chest fracture, rib cage fracture when you are trying to press. You don't know the degree, you don't know the depth, you don't know how, you don't know where to place your hands and do these things. These are things that I reviewed here in this book, both for infants, both for adults and children too. And also how to give mouth-to-mouth respiration. Most people are actually scared of giving mouth-to-mouth respiration, but we actually have a way around this. First aid is all about making use of their readily available materials to make sure that this person is safe at the time. You don't start looking for a lot of material. You don't start looking for oxygen. Those things are minor. Those things are upgraded. Like you have to actually get them in the hospital. So in such case where you don't want to give mouth-to-mouth respiration, but you just want to, you can make use of your handkerchief or even your face mask. Your face mask, you tear it into two, that thin line, you place it on the person's mouth and give mouth-to-mouth respiration. The reason why we are doing that is to prevent any transmission of, any viruses, bacteria, those kind of things, to make sure that you are also safe while you are trying to save this person. You can use the handkerchief, provided it allows passage of air through and from. That is very much okay. And then, so I also discussed about shock, where the body actually shock is actually where the body stops getting enough oxygen carrying blood. And you know what happens when the body stops receiving enough oxygen, especially the brain and any part of the body. It's a very, very serious case too. So in that case, it's a very simple thing to do. Shock, you make sure that you insulate the person. If the person is in a cold area, you make the person warm. You make this person warm, and then probably lift the person's leg to encourage venous returns, encourage the returns of blood from the distal part of the body down to the proximal part. So these are things that I discussed here. And then in this chapter, I also talked about bleeding, hemorrhage. We have different kinds of bleeding. We have the internal and external bleeding. Internal bleeding is you are seeing this person, blood is coming out from this part of the body. You don't know the source, you don't know where it is coming from. Some you know where it is coming from, but some you don't know where it is coming from. For example, when the blood is coming from the nose, you know that yes, it's the nose that is affected. But most of the time, there's a bleeding that might happen, and it looks local, but it is not actually local. It may be that there is an internal organ that is bleeding, and it is just coming out from your mouth or from your ears, from your nose, and even from your eyes. And then there are sources of bleeding too, which will actually play a very good role to show you how to manage bleeding. You know, the bleeding that happens at the carotid artery here is actually quite different from the bleeding that may happen at my hand, maybe around my capillaries. So there are lots of things to note about that, and it will help you know how to handle this bleeding when it occurs. So, and then in chapter 4, I talked about the respiratory system, where I discussed about the medical emergency choking, where choking, the universal symptom of choking is that this person cannot breathe. It shows that something has clumped this person's chest and something cannot pass through again. In most cases, it might be severe, it might be mild, depending on whichever that happens. So we have two major ways of actually handling choking in both adults and children. You can do the abdominal thrust, and you can do the abdominal thrust, and yes, it's mostly the abdominal thrust. Then for children, you perform back blows, where you turn their back, perform and give them a back blow that will push out whatever that is choking them, or you give them a chest thrust. So, and then chapter 5, I discussed about the integumentary system. That's about the skin. I discussed about bones, bones where there are damage to the skin. It could be the deeper tissues, it could be the artificial, the outer layers of the skin. And I also pointed out that there are different degrees of burns. There are different degrees of burns, which actually gives us a very clear picture of what to do when someone has burns, when this patient or this casualty has burns. You cannot, okay, we have first degree burns, and we have second degree burn, and we have third degree burn. First degree burn is just like maybe when you have a sunburn on your skin. Yeah, okay. First degree burn is when your skin has not peeled. It has not peeled. Maybe yes, it has not peeled. It's just showed something like a scar. It's painful, but not really painful. It's painful, but not that quite painful compared to the other types of burns. This particular type, you don't really need to do much because it just affected the superficial part of the skin. That's the outer cover of the skin, and then there are no blisters. There are no blisters in this one. The surface might just be moist and swollen. It's quite painful too. So it's actually heals within 3 days, which is not really much of an issue. But you see second degree burns and third degree burns, this one goes deeper. Second degree burns, actually it goes deeper than the first one, and in this case, that is where you start having blisters, and where you now start talking about infection control and all of that. Some people who do not know how to manage these burns actually end up getting infected. Their skin's getting infected. You know, people using crude oil to apply on the skin, saying that they burns them. You know, a lot of things people do. A lot of things people use aqua, the raw egg, and spill on that area. The first thing to do when when you have a burns, maybe first or second degree burns, is to place that hand under a tap, a running water, very cold one. You know, that's one of the first things to do. And then when it is third degree burns is when, oh my god, the entire layers of the skin, the first, the second, and the third is affected, and sometimes it even affects the fat, the subcutaneous layers of the skin. This one is actually deadly. Yes, it is deadly. This one, this person is born. This person is born, and the chances of survival is quite different. In the medical field, there is a way we calculate it, and know the kind of fluid, or know what to do to this patient. So in this book, I also outlined the first aid management of this, and even the preventive measures too. Then my favorite part of this book is chapter 6. My favorite part of this book is chapter 6, the central nervous system, where I discussed stroke and seizure disorders. I have worked with a neuroscience hospital, and that equally makes me partly a neuroscience nurse. So I know largely, and I'm also a stroke certified nurse. So I know most of the things that has to do with stroke and seizure management. And this stroke is actually one of the leading causes of death in older individuals. It is one of the leading causes. I think, yeah, after cardiovascular disease, that is after cardiovascular issues, you get the stroke. Yes, stroke is one of the, I think it's the second, yeah. Stroke is the second leading cause of death in older individuals. And in this book, I actually discuss on the management of stroke, and there is actually a fast way to identify stroke. When someone is trying to develop stroke, there is a fast way, and the acronym is FAST. That's face drop. When the face starts dropping, you see the mouth going this way. It could be at the left side, it could be on the right side. See someone whose face is symmetrical, the person's face is okay, straight, and all of a sudden the person's face starts switching this way. If they want to talk, and this side. So sorry, I'm trying to give a description of it. And then there will be arm weakness. The person will notice weakness in the arm. You try to lift your arm or even your leg, you won't. It will be very hard for you to lift. You will notice you've lost sensation on these areas. That is stroke. And then speech difficulties, because this thing affects the brain. Stroke is actually, it affects the brain. Stroke is a medical emergency, a very serious medical emergency. Some people say stroke is not curable, but stroke is curable only when it is detected within 0 to 3 hours of onset. And there's this drug you give most of the time. If you send this person for a CT scan or MRI, the doctors know how to check it. They know what to see in this scan and know if they should go ahead and give this patient this drug. And that drug is actually very expensive. As of 2 years ago, I heard it was around 900K. Now, an ample of it might be up to 1 million naira. So you will see that most of these things I discussed in this book, and it's quite very much important that we learn it. We actually learn it to identify them and know how to handle them, know the necessary steps to take. And then the last one is time. Time is very, very important when it comes to stroke. Time delayed is life lost. Time delayed is life lost. And then seizure disorders. Now, there is this thing people think about seizures, that someone is having seizure doesn't mean this person has epilepsy. Epilepsy is just a kind of seizure. Epilepsy is characterized by seizure. What is seizure? Seizure is abnormal wave signals in the brain, where the brain will lose coordination. Like the normal wave in the brain will be distorted, and then sometimes there will be twitching of muscles, and most of the times, sometimes there might not be twitching of muscles in seizures. There's what we call subclinical seizure, where someone will feel totally lost. This person will feel totally lost. The person is not jerking, as in jerking. What we everybody says seizure. When you see somebody jerking, they say this person has seizure. There are some people that their own means that they will become very much absent-minded. You'll be talking with this person, and all of a sudden the person snaps out. The person will be looking at you. You'll be talking to the person, and you think the person is actually hearing you. This thing might happen for like 1 minute, and then the person now gets back to him or herself. This is what we call subclinical seizures. If you notice this has happened to you quite a number of times, you're having a seizure. It's seizure happening to you. You should go and see a doctor, see an epidemiologist, see a neuroscientist. It is quite serious. And then we also have the other type where people convulse. People convulse naturally, and people say it is this person is having seizure. Now, seizure is actually not epilepsy. Epilepsy is a recurrent and unprovoked seizure. Seizure is on its own, but epilepsy is characterized by seizure, because you will see the signs of seizure in this person. It doesn't mean that everybody who has seizures has epilepsy. For example, this one happens in most children, febrile convulsion, where a child starts convulsing. What happens at this point is that the temperature threshold of this child is low, and the temperature has actually exceeded about 38 degrees centigrade. So this child's temperature regulation center is quite low and cannot control it. So there must be a reaction, and that is where the jerking starts. Most children encounters this. It is not epilepsy, because at this point you just need to take this child to the hospital, normalize the temperature. The pediatrician knows what to do to this child, and the child will be very okay. So epilepsy is a very serious thing that if it is not actually properly managed, it could result in a lot of things. And we need to know how to handle it. We need to know how to handle epilepsy, which is very, very important. And then there is something we call status epilepticus, where someone is seizuring for more than 5 minutes, or where someone is having seizures, and the gap between when this one stops and when this one starts is not even up to 1 minute. It's called status epilepticus, and it can lead to instant death. So we have chapter 7 where we discuss fracture and dislocation. This fracture and dislocation, people don't really take note of it. They don't see it as much as they see other medical emergencies. But when a fracture happens and actually punctures an artery, the person might bleed to death instantly on the spot. So you need to know what to do when someone has fracture. You are playing with somebody and the person has fracture, or you are playing with someone and this person dislocated one of his or her joints. Is actually something you should know how to handle even at home. First of all, you just immobilize the leg, immobilize the affected part. Do not move this part until you get a proper treatment for it. And then at the end extras, I actually discussed about breast examination. With the rate of breast cancer the rate at which people, young ladies, elderly people, are coming down with breast cancer is quite alarming, and it's oh my God, it's quite painful. It's really quite painful. So in this place, as an extra, I added things to do, how to check your breast as a woman. As a man, you also need to you also need to learn how to check your wife's breast. You need to know the shape. You need to know if there is anything coming out of it. You need to know everything about your wife's breast, so that when something goes wrong, you will know what to do. You will know that this is abnormal. Some people don't pay attention to their body, and that is why when things go south, when things turn out very bad, they don't notice it, and when they notice it, it's when things have actually gone very bad. Then I added groceries, and then there is somewhere I discussed about automated external defibrillator. This one is actually a machine you use when you are doing cardiopulmonary resuscitation. This one is not common here in Nigeria, but I just added it, and this is very important, so that you just have the knowledge of it in case if you see yourself in any place that has this and probably needs it. I think I've done a rundown of everything inside here.
Wow, thank you so much. Thank you so much, Miracle. From what you said, I picked out something about the drug for someone, someone who who suffers stroke. You said something about the drug being 900,000 naira. Am I correct?
Then that was 2 years ago. So it was around 900 and something K just for one ample. I think so. So it's quite
Just
expensive.
just for one what?
Just for one ample, like an ample of it, an ample of the drug,
And that
and
means
then it was quite
and then
expensive.
you also said something about quick MRI for doctors to know exactly.
Yes,
So you see the two conditions
yes.
right now. Where will someone really be able to access MRI so fast like that in such a situation? So
Okay.
you're saying that the
We
person
have
has, you're saying that this has to be identified within 3 hours. And then within the 3 hours, they must have done an MRI. And at the same time, you're going to get that drug for 1 point something million. I don't know. Miracle,
okay, okay,
what do you think this, don't you think that we are in trouble, so to say, in this nation?
okay.
What do you
Yes,
think should be a
the
solution?
okay. Let me make it clearer for people who are just joining us. Now, I said stroke can actually, to some extent, be cured only when it is identified within 0 to 3 hours, which I listed the signs of stroke for you to see. If you see these things, you know that this person is having symptoms of stroke, and you need to do something ASAP. You need to take this person to the hospital ASAP. And within that period, MRI is not actually the only scan. MRI is more like the highest scan you can have in this kind of situation. We have CT scan. CT scan is almost not, let me not say everywhere, but CT scan is quite, it's, you can easily access it. And the doctors go for MRI when they try to get something, when they want to get a detailed thing, when the CT scan is not actually giving them what they want. Now, when it comes to radioactive imaging, we have X-ray. After X-ray, we have the CT scan. After the CT scan, then we have the MRI. The X-ray is not used in all, in all the health condition. The X-ray is more like the lowest. Then what an X-ray cannot capture, CT scan has to capture it, can capture it. And CT scan is what we use mostly in stroke cases, because it is readily available and readily accessible. Then if doctors want to make further investigations and determine, maybe they see something that is not actually, something that is quite unusual, something they've not seen before or something they want to make very much clearer before they can actually give another line of treatment regimen. That is when they now go for the highest one, which is the MRI, magnetic resonance imaging. So that one is the highest. I don't know if there is anyone currently that is higher than MRI, but currently right now in Nigeria, MRI is the highest imaging. Now, if you get these things, because MRI is actually more expensive. CT scan is the one that people can actually afford. I think is around, CT scan is around 30K, so that's 5,000 naira. Why MRI is 60K and above, you can do that to get it. So in this case, we just need to try. I know it's it's quite difficult for some people. It's quite difficult, but it's better you do something to save this life and know that you did your best, other than to just leave the person and for the person to have further issues, and then when it comes for the burial time, then money will now start coming out. So at this point, it's quite painful that Nigeria is the way it is. It is quite very, very painful that Nigeria is the way it is. And that is why most doctors try to make things easier for their patients by sending them for CT scan, because CT scan is way cheaper and readily available than MRI. So
Okay,
and then for the drug, I said I think for the drug I mentioned, it's not given in all the cases. So there are a lot of things to consider first before you can give this drug, because you might give this person this drug and then it will further deteriorate a lot of things. So that's it.
I know you just gave us a soft landing so that we can have some form of hope and peace, regarding So before we go to questions, or before we call it a wrap on this session, when we're growing up, we see children have convulsions, and they say, bring spoon, pour oil. They don't put spoon, and they say if the teeth should not be joining. When the teeth join during convulsion, the child may die or something like that. Now, being a health professional, what can you tell us if a child is experiencing convulsion? Because we usually see it with children. When they're having convulsions, what's the first instant thing to do regarding that for children, so that we can have the adequate information right now regarding convulsion management in kids, especially babies,
Okay.
1 year, 2 years old?
Okay, it's almost the same thing generally. It's almost the same thing generally when managing convulsions, epilepsy, or seizure, whichever one. So the first thing to note is you don't put anything in between the mouths of this baby. You don't. If you put anything inside, it's going to cause a lot of damage. It's going to cause a lot of damage. The baby might eat it and then maybe swallow it, or even create something. Some people even put iron spoon inside. Sometimes you end up bringing this baby to the hospital with a lot of blood in the mouth. It's quite wrong. At this point, we are trying not to make anything. We are trying not to inflict pain on this child, because this is a small baby, and a lot of things can go wrong if you are not careful, because the way you handle babies are not the same way you handle adults. So in this case, a baby is convulsing. The first thing to check is the temperature. Definitely, when you feel this baby, it is temperature. It is actually hyperthermia that causes them to convulse. I'm not saying that I've seen a child that had epilepsy. We did a lot of things for this child, a lot of tests, a lot of things. This seizure was non-stop. We got a consultant pediatrician to see this baby. still this baby was seizuring. This baby was seizuring. So in this case, when a baby is seizuring, you don't try to wrap the baby, like hold the baby like this. You still give room for the baby to, so that as there won't be any restrictions anywhere to avoid injury too. Because at this point, so I like I said, you are trying not to inflict pain or make this baby have injuries. So you don't try to wrap the baby and try to make the baby to stop convulsing. It's an impulsive thing. It's coming from the brain, so you can't control it. You cannot tell the baby stop, one, stop. You can't. You cannot hold the baby's arm and say don't convulse. Just allow this baby. Allow this baby. Don't put anything in the mouth. Don't try to give water. Don't try to give drug, because it's temperature. You want to give maybe paracetamol to bring it down. You don't do that. You don't do that. You don't put anything in the mouth. You don't try to restrict them. Allow them to convulse. Just carry them and bring them to the hospital immediately. Some people, oh my God, some women in the village, they will take this child to the fire, put the leg in the fire, and be frying this baby's leg. Oh my God, I saw, working in the pediatric hospital, one day a woman brought this baby, her baby, to the hospital. And we looked at the foot of this baby. It was very messy. Oh my God, it was looking like meat. it was looking like a meat, literally. A lot of water, blisters everywhere. And you tell, and this woman said he was convulsing, the baby was convulsing, so I placed him at the close to the fire, so that the fire can actually make this baby to stop convulsing. Those things do not work. The reason why they think it works is because on a normal circumstance, seizure just lasts for a few seconds to 1 minute highest. The normal seizure, it lasts for like few seconds to 1 minute. So within the period this child start convulsing, and to the point where they now start putting the baby on fire, the seizure will now stop. And then they will now think it is because of the fire they put this close to this child that made the child to stop convulsing. It is not the truth. It is not the truth. So the first line of action, the first thing to do if you're at home and you have a baby that is seizuring or having convulsion, don't put anything in the mouth. Don't try to give water. If not, this baby will choke. Because at this point, the muscles are very much relaxed, and things can actually go into the respiratory system and choke this baby. So don't try to restrict this baby. Just carry the baby like that and run to the hospital. That's the best idea. That's the best advice I can give at this point.
Thank you so much, Miracle. Okay, guys, are there questions you would like to ask Miracle as we begin to wrap up on this conversation? We have done 1 hour, 12 minutes so far on this conversation. Are there questions you would like to ask Miracle? And then I'll bring the questions up on the screen so that Miracle can answer. Or Miracle, while people are about to to ask their questions, there are other things that you like to share with us as we are bringing this conversation to a close.
Okay. Yes. There's something I would want. I think I mentioned that earlier when we started, but I would like to reemphasize it on it. It's this part of prioritization when a patient comes to the hospital. A lot of healthcare professionals have actually been beaten. Some of them have lost their lives I've been in a situation where I've been at work where someone died and the entire relatives comes to pounce on the nurses. I ran for my life. Because one thing in this is you need to make sure your own life is safe first too, because you need to be safe to save more life. You need to be on a safe path to save more lives too. So the angry relatives came. They wanted to pounce on the nurses. Even though I was not working in that unit, I had to run for my life. I had to enter my ward and I closed the door. I was in the pediatric unit then. I had to enter the door and close my door. The thing is, I want patients, relatives to understand. Okay, let me just break it down. We are not praying to have our relatives as casualties in the hospitals. Nobody is praying for that. How be it if you find yourself in this situation, you should know that you should just be calm in this situation. You should be calm in this situation and know that a lot of people are also casualties in there. A lot of people are also casualties in there. And when we have a lot of casualties in the emergency situation, in the emergency unit, what we do first of all is triaging. Like I mentioned earlier, it is triaging. So this is why most patient relatives get angry. I think maybe this thing is not explained to them very, very well. It is not explained to them very, very well, and they actually get angry about a lot of things. Now, the reason why we do triaging in emergency situation is for two reasons: to save the lives that can be saved at that point, and also to properly utilize the available materials at that point. So take for instance someone who is bleeding from the carotid artery or from the femoral artery. This artery is, when someone is bleeding from the artery, that means it is coming directly from the heart outside, so it is bleeding profusely. And then you bring this patient to the hospital, you bring this casualty to a hospital that do not actually, you bring this client to a hospital that do not actually have the resources to make sure that they take care of this person till this person becomes stable. This is why hospitals reject casualties. They look at this person and they know that the resources they have will not be enough to take care of this person, that they can use that resources to even take care of 10 more persons. They will send this person out of the hospital. They reject this person and tell the person, we do not have space. They can just find something and tell the person, we don't handle such case here. That is what they usually say. We don't handle such case here. Take this person to this hospital. I don't know if you understand. So I want people to actually understand that when they come to the hospital, they should understand that a lot of people are there with a lot of cases, a lot of people are there with a lot of emergency situations. So everybody that will come and they will try to be on the necks of the health practitioners there. They want to hold the doctors, nurses, everybody on ground. They just want to strangle these people to make sure that their own relatives survive. We know that these things are actually not in our hands. They are not in our hands. And looking at the current situation of Nigeria, especially the health system in Nigeria, we just know that it is only God who can help us. But I just want us to have this in mind to prepare us in case of anything. Just know that a lot of things need to be put in place first before they attend to you. Glory be to God. If we are among the people they will attend to, glory also be to God if they say we cannot handle this case here. Do not try to make a fight with them because they are trying to be truthful to you. World Health Organization actually encourages that you use the resources you have to save more lives. To save more lives. So in a situation where the only available resources is to can take care of up to 20%, you don't expect the hospital or the healthcare provider to use that resources to take care of one person, and at the end of the day this person might actually go. So I just want us to have this knowledge. I don't know, just to prepare us so that we can have this knowledge in case if we come to the hospital and a lot of things are going on. So that, because us on our own part, we also feel, we don't really feel happy when patient relative curse us, when they say a lot of bad things about people working in the hospital. Most of the times it is not our fault. It is actually the situation we find ourselves. I don't know. I hope this actually makes sense to everyone watching this. Hello?
Yeah, thank you so much, Miracle. I don't think there are questions. I don't think there are questions so far that have been asked. Thank you so much. We've done 1 hour, 20 minutes of this conversation.
Wow.
It's an amazing topic, and I've pinned the post on my timeline, and I'm going to make some edits on it so those who can also watch it can watch it again and again. So, finally, before we go, how do we get copies of this amazing book, The Home Doctor? How do we get copies of the book?
Okay, it's actually on Seller. You can order for the hard copy and soft copy on Seller, and definitely it's going to be delivered to you. And if you are within the east, we can actually we build the hard copy too. We have the hard copy and we have the soft copy. So I think the link will be posted immediately after now, so that whoever that wants to order for the soft copy can go ahead and order, and whoever that wants to order for the hard copy can also order. We also order in bulk quantities in case if you want to use this material as a training material for your staff or for your school, if you run a school or whatever institution and you want to use this as a training material for them, we actually give discounts for bulk purchases. So the link for ordering is on our, it's will be pasted after now, and then you can purchase with the seller link.
How do we get across to you? Do we come across directly to you, or how do we proceed to be able to get copies of the book?
Okay, if ordering online will be difficult for you or you don't feel comfortable with it, you can actually reach me on WhatsApp 080. You can reach me on WhatsApp with 081 040 47 507. That is on WhatsApp, or you can chat me directly on Facebook and let me know that you want a copy of the book. Then I'll make sure it gets to you. So okay, I forgot to mention, soft copy is 4,000 naira, but within the next 24 hours you can get the soft copy for 3,000 naira, and then the hard copy for 4,000 naira. It just lasts for these 24 hours.
All right. Thank you so much. Thank you. Thank you. Thank you, Miracle. God bless you for this conversation and the teachings that you
Yeah.
have done for us. Thank you. I look forward to having another great conversation with you. And we
Thank you.
believe in part that what you've taught today So, guys, if you got any question whatsoever, or you want to connect with Miracle, please do ahead to connect with her right directly on our Facebook channel, Miracle. All right. Thank you so much, and
Thank you.
God bless every one of us. And good night.
Thank you. Thank you. Good night.